So you clicked on this video and you may just be here to learn, and that's great, but you may also be in the process of making a choice. And if you fall into that category, I've linked some very helpful resources down below to aid you in the process of choosing between parenting, adoption, and abortion. They are non-judgmental resources, including the All Options Hotline, a phone number you can call to talk to somebody and work out your feelings on everything. I will put the number up on the screen now as well. Please check those out in the description box below. Hey y'all, welcome back. I'm Mama Dr. Jones, a board-certified OBGYN and mom to 4, and today we're talking all about medication abortion. With the volatile climate of reproductive health in the United States, I thought it was important to make this video to give you information that you may not get from people that are around you. A lot of the new laws have made people very fearful, and I just want you to have the information. That being said, this is educational only. If you have any questions about your specific situation or about something you hear in this video, please bring them up with your own doctor or advanced practice provider. If you are not here to learn, please leave. This is an educational video. Let's not make it a fight. You can fight on the other videos I've made on abortion. Around 60% of abortions in the United States are prior to 10 weeks, and about 92% are prior to 13 weeks. Today we'll discuss medication abortion for use up to 70 days of gestation, which is about 10 weeks of pregnancy. All of this information has come straight from the American College of OB/GYN, and if you want to check out any of my sources, I will link them in the description box down below. So what is medication abortion? Basically, in the most simple of terms, it is taking a pill, usually 2 pills, that causes your body to shed the uterine lining, thus ending a pregnancy. The standard, most effective medications for this are the same medications that would be used for a missed abortion, which is the medical terminology for a missed miscarriage, or a miscarriage that your body just hasn't recognized is happening yet. The medications include a combination of mifepristone, which is taken 24 to 48 hours prior to a medication called misoprostol. Although that is the recommended medication regimen, mifepristone is incredibly difficult to get in many places around the United States because of unnecessary FDA regulations, which don't make the medication use any safer and cause unnecessary hurdles in people getting adequate evidence-based care. Who can have a medication abortion, and are there any contraindications? What you'll typically see as the recommendation is that medication abortion can be used up until about 10 weeks into the pregnancy or 70 days gestation. Now, there are reasons that you could do it beyond that, but that should be at the discussion of whoever is specifically taking care of you. Reasons you would not be a good candidate for medication abortion would include you are past that 70-day point, in which case you'd have to discuss it with your healthcare provider. You have an IUD in place, you have an ectopic pregnancy risk factor or symptoms of an ectopic pregnancy, you have a known bleeding disorder like hemophilia or are on blood thinners, you're on chronic steroids, or you have a history of porphyria or adrenal failure, or if you have a history of allergies to the medications. So really, that's very few contraindications, as most of those things I just mentioned are quite rare in people who are of reproductive age, but you should know that those are the reasons that you would not be a good candidate to take an abortion pill. So what happens when you have a medication abortion? As we discussed earlier, you take a pill or a combination of medications as they're prescribed from your healthcare provider, and usually within a pretty short period of time, you will experience heavy bleeding. It's usually heavier than a menstrual cycle, and cramping, which is usually more severe than a menstrual cycle. For some people, the pain is not so bad. For other people, it's really significant. The pain peaks generally about 2 to 4 hours after the medication, the last medication that you take, and it lasts for about an hour at that peak level. There are some trials out there on over-the-counter medications, and they have found that ibuprofen tends to be the most helpful for improving pain related to a medication abortion. Some providers will also prescribe a medication if you ask them to, but of note, opiates haven't been shown to be really helpful in this, so it's probably not a good reason to be taking an opiate medication, which comes along with some risks. That's an individual discussion to have with whoever takes care of you. There are some side effects to these medications, and they don't happen in everyone, and there are also things that happen not uncommonly in pregnancy. They're usually related to the misoprostol medication, and it would be things like nausea, vomiting, diarrhea, hot flashes, chills, just generally feeling unwell. Severe side effects are incredibly rare, and that would be things like an allergic reaction to one of the medications or severe bleeding that requires medical treatment. That'd be about less than 0.1%, or the need for a transfusion of blood, which is like 0.01%. So incredibly rare, but not impossible things that can happen. As a general rule, if you're soaking more than 2 pads in an hour, and that goes on for 2 consecutive hours, then you should be evaluated by a healthcare professional. So that's a menstrual pad, you're wearing it, and within an hour, you have completely saturated 2 of them. The next hour, same thing. Definitely need to let your healthcare provider know so they can evaluate you. Again, severe hemorrhage is incredibly rare. Less than 0.1% of people who have medication abortion will experience that. How do you get the abortion pill or Plan C? In general, if your menstrual cycles are relatively regular and your last period was sometime in the last 56 days, and you don't have any signs, symptoms, or risk factors for ectopic, then you should be a candidate for a medication abortion pill without having to have a physical exam or ultrasound. That being said, some states have put in regulations that make that nearly impossible, so it will vary by where you are at. As far as ectopic pregnancy signs and symptoms and risk factors go, what you're going to be looking for there is if you have any history of a prior ectopic pregnancy, of surgery done on your fallopian tubes, if you have an IUD currently in place, or if at the time you got pregnant you were using a progestin-only type of medication, Depo-Provera, arm implant, hormonal IUD, or progestin-only pill. Or if you have spotting, vaginal bleeding, or pelvic pain, those are things that you need to have evaluated first before you seek a medication abortion pill. If your blood type is negative, then you may need an anti-D injection, so that would be something to talk with your healthcare provider about as well. There really are no additional labs or workup or ultrasounds that are required for medication abortion to be done safely. Again, though, many states have ridiculous regulations, and it may be difficult for you depending where you live. Telehealth visits have been found to be equally safe and effective as being seen in person. So as long as you don't have any of the things I talked about earlier that would be needing to be evaluated in person or have an ultrasound prior to using the medication, you should be able to seek a telehealth visit. This can be difficult in some states because you may not know who will provide you that prescription. I'm going to link down below Aid Access, which is an organization that works to provide access to medication abortion for people through the United States and Canada. It is available in some form in every state, but the wait time can be quite a bit longer in states that are really restrictive because you have to go through a little bit of a different process. So you can check that out below. They have all the information on their site. I've also linked, again, 3 for Freedom from Jennifer Lincoln, which includes information on how to get birth control pills, emergency contraception, and abortion pills by mail. So what do you do after you've had a medication abortion? Generally, you're going to want to have a follow-up visit about 1 week after you take the medication. This can be done with a telehealth visit, a phone visit, an in-person visit, or in some situations, a home assessment. And then they will typically recommend a follow-up urine pregnancy test, which you can also do at home 4 weeks after the medication. This is just to confirm that the pregnancy had completely cleared. That being said, if you don't experience any bleeding or cramping after taking the medications, that would be a reason to call or visit sooner because that means they may not be working effectively. Common question I see and a common thing brought up as misinformation is, will a medication abortion affect my future fertility? The answer to this question is no. Your future fertility and future pregnancy outcomes are not negatively impacted by having a medication abortion at an earlier point in your life. This is based on several studies, which I will link down below, and is a direct quote from the American College of OB-GYN. Another thing that is important here, in my opinion, is to talk about contraception. If you are seeking a medication abortion, you probably have an unintended or unwanted pregnancy. And if that is the case, we need to assess why your planned method of contraception didn't work for you. If you fall into a category where you were physically assaulted, then in that situation, you don't need ongoing contraception. If you fall into a category where you have sex with people who can get you pregnant, we need to figure out what was your contraception you were using, why did it fail, and what can we possibly use that might be better for you. You should also think about how your healthcare provider can help you improve your ability to access those medications when you need them, because oftentimes I see people getting prescriptions for a contraceptive pill and they're only given 3 months. They get to that 4th month, the pharmacy won't refill it, and it delays their ability to start the next pack. So if there's something like that going on, you need to talk to whoever prescribes it for you to see what you can do to get a longer term prescription and better access to your medications to prevent something like that in the future. A very good resource for reading about and learning about birth control of all types, all kinds of contraception, is bedsider.org. They present information in such a great way, a way that it's easy to understand and read and lovely to look at, and it's all evidence-based. So I will also link bedsider.org down below if you want to check out contraceptive options from them. I hope that you learned something today, y'all. Thank you for being here. I genuinely appreciate you giving me the opportunity to educate you on such a wide range of topics. Hit that subscribe button, turn on notifications so you never miss an upload. I'll see you next Monday.